Thanks for joining us for KSAT News at 9. I'm Courtney Friedman. Tonight, we're continuing to track all of the day's COVID-19 developments. Coming up, we have details about the way COVID-19 is forcing Fort Sam to change the way committal services are conducted. We'll also ask an infectious disease doctor some of the questions you, our viewers, sent us about the pandemic. And if you've been ordering a lot of takeout, we have some tips for you to make sure germs are staying out of your home. But first, we'd like to start with the latest numbers tonight. There are now 57 positive COVID-19 cases here in Bexar County. More than a quarter are community spread. Here's a look at how those numbers break down. 28 are travel related. 7 were spread through close contact with someone who previously tested positive. 16 are community spread, and the source of exposure for 6 cases is still under investigation. The county's first death was reported yesterday. According to city officials, the woman is in her 80s and had underlying health conditions. And at Joint Base San Antonio Lackland, 15 personnel have now tested positive. Statewide, Texas Department of State Health Services is reporting more than 350 cases and at least 8 deaths. Across the nation, the Centers for Disease Control and Prevention says there are more than 33,000 cases and at least 400 deaths. But according to Johns Hopkins University in Medicine, there are more than 375,000 cases globally and more than 16,000 deaths. Johns Hopkins counts presumed positive cases. Running at maximum capacity. That's how Assistant City Manager Dr. Colleen Bridger describes her staff's response to COVID-19. Officials have still not released the name or exact age of an area woman who died over the weekend from complications of COVID-19. Dr. Bridger says public awareness about COVID-19 is prioritized over releasing specific information about the victims.
This is by far the most complex pandemic I have ever been involved with.
A testing task force is in place, so what'll happen going forward in this pandemic? We'll take a closer look on the Night Beat at 10. Today, tighter restrictions announced here in our area as an effort to reduce the spread of COVID-19. Today, San Antonio and Bexar County announced a stay home, work safe order. It basically asks residents to stay home unless you work for essential businesses like healthcare, first responders, or government offices essential to function. Exemptions include financial institutions, education personnel, daycares, transportation, construction, and funeral services. Grocery stores and those in the food industry, of course, are also allowed to continue to operate with limitations.
It's very simple for us to get through this crisis globally and save some lives in the process if everybody just is aware of the precautions necessary to save ourselves and our family members, and that is to stay home when there's an infectious disease that's on the rise. It's not complicated. Stay home, save lives.
The order goes into effect tomorrow at 11:59 p.m. Enforcement in the form of citations will be given to those who are caught going about with any official business. The coronavirus also impacting the way veterans are buried and honored. All Department of Veterans Affairs national cemeteries will adjust operations in response to COVID-19. At Fort Sam Houston National Cemetery, new guidelines were implemented today. Our Tiffany Huertas reports that include suspending funeral honors and large gatherings.
She was married to my father, who was in the Army.
Rebecca Redding came to visit her mother Monday afternoon at Fort Sam Houston National Cemetery. Rebecca says she can't believe the changes the cemetery has put in place.
If this was going on, my dad passed away, God forbid, tomorrow, I would be very upset not having him honored in the way that he would want to be honored.
Funeral homes will come out, and then we'll take over custody of the remains, and then we complete the interment process.
This will be the only way those who served our country will be laid to rest at Fort Sam Houston National Cemetery until further notice.
We're currently not holding committal services at our shelters for family members to attend.
As part of federal efforts to limit the spread of coronavirus, large committal services and military burial honors will come to a stop at veteran cemeteries.
Currently, our volunteer honor guard, they are VA volunteers, and they currently are not rendering honors because we're not having any committal services at our shelters. We're doing this to protect not only the funeral homes and the families, but our volunteers and our staff as well.
The cemetery will remain open for visitations. The director of Fort Sam Houston National Cemetery says they're following guidelines from the CDC.
So even though we're open and for visitation, and the community is more than welcome to come out and visit their loved ones' grave sites, we just want them to stay safe and minimize the travel if they can.
Cemetery Director Aubrey David says even if families choose to have a person buried right now, they can schedule a full service at a later date.
I think for our national cemeteries, it's our job to provide dignified, respectful burials for our veterans, and I'm just glad that we're able to remain open and continue to provide those services.
For the 9, Tiffany Huertas.
Families may request to view the burial, but they will be kept at a safe distance with no more than 10 immediate family members. The U.S. Department of Veteran Affairs says families can postpone a currently scheduled burial to a later date. Bernie also adding more restrictions today in an effort to slow the spread of COVID-19. Bernie's mayor amended the city's emergency declaration and is urging residents to stay home unless they are required to be at work providing essential services to the community. The declaration also now says people should avoid gatherings of any size and requires people returning to Bernie after being more than 100 miles away to self-quarantine for 14 days. Meanwhile, the city of San Marcos also issued new guidelines today. The city is closing the Children's Park Playscape, the City Park Playscape, all neighborhood park playscapes, and the dog park and skate park. All public restrooms and water fountains in city parks and natural areas will also be closed and shut off beginning tonight until further notice. Across the nation, more states are issuing new emergency orders. This as negotiations for a massive stimulus package from Washington are still underway. Tonight, 1 in 4 Americans is staying home. At least 17 states have imposed restrictions, closing businesses, forcing people to work from home, or forcing them out of a job altogether. In addition, a shortage of supplies at hospitals nationwide. The chief of surgery at Columbia University warned in a memo to staff at the hospital is burning through 40,000 masks every day, when on a normal day they use about 4,000.
We're running into potentially crisis situations, having to make the split-second decision. Am I going to run into this room to save this patient, or am I going to take the time to try and scramble and find a mask?
In Washington, growing frustration over the nearly $2 trillion stimulus bill, now blocked twice by Democrats who say it puts big business ahead of American workers. President Trump, perhaps growing impatient with the country shutting down, says America cannot let the cure be worse than the problem itself. Now let's turn to tonight's 9 at 9. A local man shot and killed in his car early this morning. A California electric company agreeing to a plea deal in a deadly 2018 fire, plus a roundup of how COVID-19 is impacting communities across the world.
Here's tonight's 9 at 9. During a press conference today, the director of the World Health Organization released staggering numbers to show how quickly COVID-19 is spreading globally.
The pandemic is accelerating. It took 67 days from the first reported case to reach the first 100,000 cases. 11 days for the second 100,000 cases. And just 4 days for the third 100,000 cases.
A local man's been shot and killed while sleeping in his car. Police say 2 men in masks walked up to the truck, pulled out a gun, and shot the man. They're still searching for the suspects. California's gas and electricity company, PG&E, has agreed to plead guilty to more than 80 counts of involuntary manslaughter in connection with the 2018 wildfire. Under the agreement, the company will pay the maximum fine of $4 million. State investigators say that fire was started on November 8, 2018 by sparks from a PG&E transmission line that failed.
Since the 2018 Camp Fire, PG&E has taken additional safety actions to reduce wildfire risks, including enhanced inspections and adding additional vegetation management.
The U.S. Supreme Court says states can bar insanity defenses. Today, the High Court ruled against a man who argued his constitutional rights were violated when the state of Kansas refused to let him bring an insanity defense. In a 6-3 opinion, the court ruled an insanity defense that considers whether a defendant can distinguish between right and wrong is not required by the Constitution. An Alabama tattoo shop is stepping up to help out during the COVID-19 pandemic. They're providing badly needed medical supplies like masks, isolation gowns, and gloves.
Anything we can do to help them out, and ultimately it helps everybody out because it keeps our health workers, our healthcare workers healthy, safe, you know, so that they can be here for us as well in the event that we get sick.
The government of the United Arab Emirates has ordered the closing down of shopping centers for at least 2 weeks and has advised residents to limit movements. Restaurants have also been limited to deliveries only. Here at home, if you've been on the hunt for hand sanitizer, by now you might have noticed store shelves have been wiped out. It's why local distillery Ranger Creek is making its own and distributing it for free.
We decided to get together for the community and change up our production a little bit, make some high-proof alcohol for hand sanitizers to give out for free.
Rosario Dawson has been cast in season 2 of The Mandalorian, according to Variety. Dawson will play the role of Anakin Skywalker's apprentice. The new season of The Mandalorian is set to be available on Disney Plus this fall. And take a look at this. An Australian zoo is live streaming animal enclosures for those at home, but it's this zookeeper's dance that has everyone entertained. To read more about these stories, just head to KSAT.com.
Hey guys, I'm meteorologist Sarah Spivey, reporting the weather from home. So I thought I would take you through the forecast. First, I want to show you the pollen count. So a lot of people are having some issues with their allergies, and mold is actually very high today. It's at 16,400 mold spores per cubic meter of air. So that is really causing a big issue. The reason why mold is so high is because we've seen a lot of rain over the last few days. In fact, the airport, we saw a little bit less than an inch of rain since last Thursday. That's good, healthy rainfall, but a lot of us have been cooped up.
We'll be back in just 1 minute.
Welcome back to the KSAT News at 9. We're continuing our effort tonight to fight fear with facts as the coronavirus pandemic continues to impact communities across the globe. Infectious disease doctor, Dr. Ruth Berggren from the Long School of Medicine at UT Health San Antonio, back with us to help us get answers to our coronavirus questions tonight. Dr. Berggren, thank you again for joining us. Off the top, I want to talk about how can San Antonio residents help? We talked about blood drives in the past few days. We talked about a lot of stuff, but you have a very good idea of how San Antonians can help specifically over the next 2 days.
Right. Well, first I want to reiterate the number one way you can help is by not getting infected. And that involves listening to the directives and staying home and working safe, as has been recommended. But we have planning for possible surges in cases, and we may face a critical need for protective gear for healthcare workers. And so UT Health is working to support our clinical providers by facilitating the collection of supplies of this protective gear, and we're asking the public to help. So what we're looking for is N95 respirator masks, other face masks like surgical masks. They can also use masks that are used by painters, carpenters, and hobbyists. We prefer that it's not be used masks. We ask for medical or disposable gloves, eye protection goggles, but no swim goggles, face shields, and thermometers. So again, original unopened items are preferred, but not required. But don't donate used gloves or masks.
Right.
And these can be donated for 2 days, starting tomorrow from 7 in the morning till 6 in the evening at 7703 Floyd Curl Drive. And there is a guard shack that's just off of Floyd Curl. If you pull in there, you'll be directed accordingly.
Great. And that's actually one of the big questions we get from our viewers a lot in this whole thing is, what can I do to help? So N95 masks, surgical gloves, thermometers, face shields, just to prepare if those things become, if the surge that comes, those things are needed, correct?
And it's not just N95 masks, it's what we call surgical masks or procedure masks. Those are the softer ones with the little loops that go around your ear.
Yeah.
Looking for those too.
Any of those would help. All right. First question, next question from our viewers. Does a person develop an immunity to COVID-19 if they become infected and recover?
So the good news about that is yes, and that's really why we have hope that a vaccine will help us. But what we don't know at this time is how long that immunity will last, whether the virus will mutate, and whether one vaccine would be good for a long time. So there's still a lot to learn about this virus, but we remain very optimistic about the fact that humans can develop immunity to it, at least for a period of time.
Yeah. Next question. Is it accurate to say that taking ibuprofen for fevers, pains, aches while you have COVID-19 will only worsen the symptoms? I've actually seen this reported online and social media as well.
So that report is stemming from some observations that were really made in a limited number of patients. A particular physician in France has been promoting this. We would prefer at this time, until we sort it out, that people use acetaminophen, which is Tylenol essentially, according to the instructions on the label for any aches and pains that they might have. Now, if people have a need for their ibuprofen or their nonsteroidal anti-inflammatory drug as directed by a physician, they should continue to use those as directed. At this time, it's not really, we can't say with confidence that what you asked in your question is correct.
Yeah.
But we're directing to preferentially use acetaminophen instead of ibuprofen.
Great. All right, next question. I had viral meningitis more than a year ago. Am I more susceptible to COVID-19?
So first of all, I'm sorry that you had viral meningitis, but that's not one of the risk factors for COVID-19. And unless you had viral meningitis because of some underlying condition that predisposed you to it, such as some sort of immunodeficiency, the answer is no. That episode by itself does not put you at high risk for getting COVID-19.
Great. All right, next question. Should people working at drive-thrus and at stores be wearing gloves?
Probably a good idea. If you have the gloves and you can put them on and take them off properly, I think that's wise, and I recommend it. The thing is, when you remove the gloves, to remove them without contaminating your hands, and always to do hand hygiene before you put them on, and throw them away when you're done, and do hand hygiene again after you're done using the gloves.
Can next question, can the virus be spread through vents?
So what we know is that the virus can become aerosolized, meaning that someone who has a cough or a sneeze, and there are respiratory droplets that spew out, and those aerosols can last for a while. And some estimates are that they can last a couple of hours, maybe up to 3 hours. If somebody was coughing or sneezing right where there was an air intake, then theoretically, yes. But here's the good news. It's not likely that that's how the virus is spreading.
Yeah, that is good news. All right, final question for you. In light of the order to stay home, work safe, what would you tell people in Bexar County and San Antonio and the surrounding areas tonight about this latest emergency declaration?
I think we should be grateful that we have enlightened leadership, that our community is taking action. I know this is dire. It's difficult for everybody. These are extraordinary times. We've never lived through times like these. But if we do nothing, we know for sure we're going to have rapid community spread and overwhelming our hospital system. So believe it, when you stay home and you don't go out and interact with other people, you are saving lives. And please, San Antonio, please remember to be kind to one another. We can't control what's happening to us, but we can certainly control how we treat one another.
Love that message. Dr. Ruth Berggren from UT Health San Antonio, the Long School of Medicine. Thank you for your time once again tonight. All right, before we go to break, I think we have Sarah Spivey, and we're going to try weather one more time.
Hey guys, I'm meteorologist Sarah Spivey, reporting the weather from home. So I thought I would take you through the forecast. First, I want to show you the pollen count. So a lot of people are having some issues with their allergies, and mold is actually very high today. It's at 16,400 mold spores per cubic meter of air. So that is really causing a big issue. The reason why mold is so high is because we've seen a lot of rain over the last few days. In fact, the airport, we saw a little bit less than an inch of rain since last Thursday. That's good, healthy rainfall, but a lot of us have been cooped up inside, maybe wanting to go take a walk outdoors or take the pet for the walk outdoors. The good news is you'll be able to do that over the next few days because we will see tons of sunshine. But let's take a look at the numbers today. Know that the high temperature was pretty warm, 81 degrees, and that is interesting given the fact that we spent most of the day cloudy. I want to show you the satellite imagery from today. We started off completely cloudy, but we were able to see a little bit of sunshine by about 2 o'clock in the afternoon. Now this is important because tomorrow we'll start with clouds and fog, but we'll clear out a lot quicker than we did today. So in the forecast tomorrow, it's gonna be a warm one. By noon, we'll have partly cloudy skies. Again, that's after morning fog and cloud cover. And then in the afternoon, mostly sunny. We'll be warm, near 90 degrees with a west wind at about 5 to 10 miles per hour. I wanna go ahead and show you the weather setup across the nation. It's fairly quiet. And the reason for that is in the southwest, we've got a ridge of high pressure that's gonna be moving into place. Now that high pressure system, that means dry, high means dry, and around this time it also means heat for us across south central Texas. So as I take you through the futurecast, you'll notice that high pressure system settling over south central Texas, and that means warmth for us. Just about every day this week will be near 90 degrees in San Antonio. So it's gonna be warm, it's gonna be sunny, and it's gonna be a little bit muggy. But if you are craving some of that outdoors time, again, it should be nice for that. We will be cranking the AC though, however. So Tuesday, Wednesday, Thursday, Friday, close to 80 degrees, but we get a front that moves through early Saturday morning. That's gonna knock our high temperatures down into the 70s for the weekend. Not really gonna be bringing much of a chance for rain though. So looks like we're done for our rainfall for March, and we were just about average for the month of March. If you have any weather questions, you can reach out to us at weather@ksat.com.
Well, since the coronavirus began to spread, we've heard several versions of orders to contain the virus. Each, however, has its own meaning and can vary from state to state and city to city. Ursula Perry explains why they're all different in communities around the world.
The headline may read shelter in place, but in Dallas, the actual order is called stay home, stay safe, intended to keep hospitals from exceeding their capacity should COVID-19 have a catastrophic spread. Stay home, stay safe allows residents to leave home to buy groceries and medicine, go for outdoor walks, and care for sick relatives, as well as for essential personnel to do their jobs. San Antonio's new order is called Stay Home, Work Safe. It asks all those in Bexar County remain at home, work from home, stay at home, and only leave for essential errands or emergencies. It should not be confused with shelter in place, which is traditionally an order issued during an imminent attack or danger like a hurricane or an active shooter. It is also not a lockdown, as was ordered in Italy and China during the height of the spread of COVID-19. In a lockdown, residents are not allowed to leave their homes except in emergency situations and only with permission from authorities. Meantime, in California, the shelter-in-place order is similar to New York's new pause plan. Both are essentially a stay-at-home order, but it's the semantics of the order that are different. And finally, no place in the United States has been ordered completely locked down, as in people can't leave their homes at all. Martial law has not been evoked. That said, misdemeanor penalties for violating the rules of stay-at-home orders do vary from state to state and city to city. So know that your cooperation is not only being requested, it's being required in the hope that this new normal is just a brief phase. Ursula Perry, KSAT 12 News.
And with all this going on, we have a great update for you about our KSAT tech team coworker who's been stuck in Argentina under a quarantine for all foreign travelers from nations affected by COVID-19, the United States included. Sebastian Hovel is on a plane right now on his way to Chile, where then he'll fly to Atlanta and eventually home to San Antonio. A long journey, but one he told me almost didn't happen at all.
He's been sitting at the airport in Buenos Aires for 2 days after his original flight got canceled. Some people around him have been waiting for 4 days to get flights out, and the tension was high. Sebastian sent us this picture of a quarter of a sandwich, the first thing he'd eaten in a day, saying the airport vending machines ran out of food for a while. Coincidentally, he met a man from Dallas named Jerry, also an IT worker trying to get home. What are the odds? They teamed up to speak with the airlines about getting on the next flight, and luckily, they did. They took off around 7 p.m. Texas time, 9 p.m. Argentina time. It'll be a long trip home, but he's keeping his family, work family, and tacos in mind.
Yeah, we did talk about food, so he's excited for that. We've been following Sebastian's journey since he was first quarantined, and we'll continue to keep you updated on the rest of his trip home. To see the other stories we've done with him, just head to KSAT.com. Well, Ukrainian foreign exchange student who's been studying in Jordanton for 8 months is headed home early because of the coronavirus pandemic. Alla Mueller was chosen out of thousands for a competitive exchange program. The goal for Ukrainian teens to learn more about America and democracy. Alla has flourished in her 8 months in America, becoming close with her local host family, getting good grades, and even dating a new boyfriend.
We were supposed to have our 6-month anniversary, I guess, on 25th of April. And we were supposed to go to prom together.
Missing out on prom. The Ukraine government is allowing native students to fly home from America, but Alla's parents don't know how long that will last. So they've decided to book her a ticket home on Thursday. She hopes to return to the U.S. for college, saying she loves the American education system. A local nursing student excited to volunteer during the pandemic after Governor Greg Abbott announced yesterday that he will waive regulations to allow nursing students to jump in and help should there be a nursing shortage. Jasmine McGill is a 4th semester San Antonio College nursing student who's been hard at work on her home and online clinicals. She says she is ready to help assist in any way during this fight against the coronavirus. She says right now it's important that everyone work as a team because it's an all hands on deck situation.
Everybody bands together right now and just stay safe, but continue to serve and don't panic and just go home and love your family from a distance, love your patients from a distance, and just continue to do what you do best.
McGill says that she's unsure when she and her fellow student nurses will be called to help, but she's positive about the future. Turning to tonight's top stories, for the time being, no abortions will be performed in Texas unless the mother's life is in danger. This being done in an effort to preserve medical resources for COVID-19 patients. Texas Attorney General Ken Paxton made the announcement today, one day after Governor Greg Abbott ordered healthcare facilities to postpone procedures deemed not medically necessary. A Centro Med healthcare provider who works at the Sarah E. Davidson Clinic at Haven for Hope has tested positive for COVID-19. That provider has been placed on a 2-week quarantine at home, and staff at the Davidson Clinic and the Paloma de Paz Shelter Clinic were also sent home so the facilities could be sanitized. According to a news release, the two clinics share some of the same staff. Several other Centro Med employees have also been directed to self-quarantine. Northeast Independent School District has launched counseling hotlines for students having a tough time dealing with all the new coronavirus news. Starting today, counselors will be available by telephone. They'll work on a rotating basis to answer the support lines weekdays from 8 a.m. to 4 p.m. We have information on how to get in touch with the counselors at KSAT.com. With more people staying at home during the novel coronavirus pandemic, more people are also ordering their meals to go from restaurants or having them delivered. In this week's Adulting Hack, RJ Marquez tells us about a few ways to make sure you leave unwanted germs at the doorstep.
One of the safest things you can do is limit the contact you have or not make any contact at all with the delivery person during the handoff. This means paying ahead of time through the phone or through an app if possible. You can then ask the delivery person to leave the food outside your door. Once the food is inside your home, the next thing you can do is take it out of the containers, throw those containers away, and wash your hands thoroughly with soap and water. Health experts also say it's best to have an area on your countertop to place the food and wipe down that area with disinfectant. Next, do not grab the food with your hands. Try and use a utensil to move the food to one of your containers and then wash the utensil. If you want leftovers or have ordered extra, it's best to transfer the food to your own container before putting it away. You don't want to keep anything that came from the restaurant in your home. The goal is to make sure the food is not being transferred from packaging materials to your hands. The Centers for Disease Control and Prevention says there is currently no evidence to support that the virus can be transmitted through food, but keep in mind the National Institutes of Health says the coronavirus can live on cardboard surfaces for 24 hours, stainless steel for 2 to 3 days, and on plastic surfaces for up to 72 hours. For the 9, RJ Marcus.
Thank you so much for joining us for the news at 9. Take care of yourself, take care of others, and make sure to watch the Night Beat starting at 10.